Hi, this is Dr. Karima Hirani, and today I'm going to be talking to you about the functional medicine approach. But first, a little bit about me. I'm a graduate of the USC Medical School. I have a master's in nutrition from the UCLA School of Public Health. I'm board certified, and I'm an assistant clinical professor at the USC Medical School. I've been practicing functional, integrative, complementary, and alternative medicine since 1999. So let's begin with a definition of functional medicine. Modern medicine is very good at compartmentalizing diseases. For example, if you have heart disease, then the cardiologist takes care of that. If you have headaches, then the neurologist may need to take care of that, and etc. Medical research is just beginning to realize the connectedness of disease states. For example, if a patient has rheumatoid arthritis, he or she may also be at higher risk for heart disease. Or if a woman has diabetes, she has a 40% increased risk for breast cancer. The functional medicine approach would address the underlying cause of the rheumatoid arthritis, and in so doing, it would also help prevent the heart disease that this patient is at risk for. So functional medicine seeks the root cause of your illness. It's a whole mind-body approach, and it does not compartmentalize your illness. In my opinion, functional medicine is the medicine of the future. So many times patients have come to me because of dissatisfaction with the current medical establishment. They will say, I asked my doctor if there was any deficiency I have, or hormonal imbalance I have, or if this is related to my diet. But my doctor just said, here's the prescription for your problem. There is no known cause for it. I recently had a patient that came to me because she had been to the emergency room due to altered mental status. She had had a full workup, including CT scans and blood cultures to rule out any brain lesions. She was then referred to the mental health clinic in Hollywood. After an evaluation there, it was decided that she needed to return to the emergency room because they could not figure out the cause of her altered mental status. Well, upon getting the full history, I find out from her son that she used to be on thyroid medication, but due to cutbacks in Medi-Cal, she was no longer eligible for the free thyroid medication, so she had just stopped taking it. Once we resumed the thyroid medication, she was back to her normal state of alertness. This story is a great example of the importance of taking a thorough history and not rushing through a patient visit in 15 minutes. Another example is that of a young man, a very successful businessman, who had been married just a little over a year and was in marital counseling with his wife. He was very irritable and had been seen by the doctor, who had recommended going on medications. Well, after a detailed history, I determined that his problem was hypoglycemia. I told him to switch to 5 small meals a day instead of 3 big ones, and to include protein in each one of those meals. He had to keep snacks such as nuts and seeds around him at all times. Lo and behold, on the next follow-up visit, he was much happier. Needless to say, so was his wife. These 2 examples illustrate the need for a thorough history intake. I will get to the biomedical testing in a minute. The focus of functional medicine is on the patient and everything that surrounds him or her. The diet, the work environment, the sleep patterns, occupational exposures, etc. Unfortunately, even today, medical students are so focused on diagnosis instead of connecting with the patient in order to really help them. Since I teach at the medical school, I get to see this disease-centered approach firsthand, but luckily, the group I teach is learning the patient-centered approach. Patients are no longer satisfied with the prescription for medications for every ailment. They want a physician who is willing to think outside of the box, spend time with them, and be their partner in their search for optimum health. What to expect at my clinic? I spend 90 minutes with every new patient going through an 11-page health history questionnaire that they are required to fill out beforehand. They get a complete physical exam with blood work, dietary and supplemental recommendations, a measurement of fat mass, lean muscle mass, caloric expenditure, and extra and intracellular water levels are some of the data I measure and use to make recommendations for optimizing their health. A vitamin B12 shot that is non-toxic and can be very helpful to some people suffering from anxiety, depression, and fatigue is recommended quite frequently to all new patients. The functional medicine tests are very appealing to patients looking for answers to their illnesses. I frequently run nutritional panels which measure all the amino acids, fatty acids, minerals, vitamin status, antioxidant status, markers of oxidative stress, metabolic and detoxification pathways, etc. The digestive stool analysis measures markers for digestion, absorption, inflammation, levels of friendly bacteria, bad bacteria, yeast, and parasites. This is an extremely useful test for my GI patients. The food sensitivities test measures antibodies that are delayed reactivities and can be oftentimes the culprit of many symptoms. Identifying genetic variations helps uncover weaknesses of enzymes involved in pathways for detoxification and various biochemical reactions. Once discovered, I can make dietary and vitamin recommendations to help my patient. Hormonal testing can identify imbalances which, when corrected, can reverse depression, fatigue, anxiety, weight gain, etc. Chronic mercury burden is largely unrecognized in conventional medicine. However, when diagnosed through appropriate testing and then treated, patients can recover from memory loss, fatigue, depression, just to name a few. Perhaps because of my nutritional background, emphasis on diet and nutrition is the mainstay of my practice and success. The elimination diet as a functional medicine test, I truly cannot tell you the exact number of patients that have benefited from doing it because they've been so numerous. From chronic fatigue, IBS, to depression and anxiety, people have discovered very often that what they put into their bodies is affecting their health. It is always unfortunate when I see a patient who just wants a quick fix and is not willing to put in the effort needed to discover that in their diet there may be a food or drink that is not agreeing with them. Diet is the focus. When it comes to conditions such as ADHD and autism, the gluten-free, casein-free, and sugar-free diet is so very beneficial. For IBS patients, I tell them that the 3 major dietary triggers are caffeine, sugar, and refined carbohydrates. Once these are removed as part of the elimination diet, to their surprise and joy, they may discover that one of these foods is the trigger. Dyspepsia and reflux can also be easily resolved with the elimination diet and testing for food sensitivities. I am amazed when I see a patient with chronic insomnia whose doctor never suggested they stop the caffeine and alcohol, or at least significantly cut back. It's much easier and quicker, I guess, to write a prescription for a sleep medicine. Fruit juices and sodas are not recommended for anyone because of the toxic potential of fructose, which is found in both drinks. Patients will tell me, "Even fruit juice? My son loves apple juice. He drinks it all day. I thought it was good for him." I tell parents and patients to watch Dr. Lustig's video, Sugar, the Bitter Truth, to learn exactly how harmful these drinks are to everyone. There is a link on my website and my summary. So water and milk, unless you have a dairy intolerance, are the preferred drink recommended. I encourage my patients to fall in love with whole foods and water. If a patient is overweight and needs help with dietary recommendations, I use the BIA machine to determine their caloric need, then give the patient a detailed dietary program that is based on the Mediterranean diet. Portion control and variety of food groups is the focus. Once your lab results come in, we sit down together and review them in detail. I most often discover deficiencies or imbalances. Now I know exactly what to nutritionally prescribe to you. For example, if I ran the nutritional panel on you, I could uncover a need for B vitamins, vitamin E, and vitamin C, and that you need to cut back on your vitamin D. Also, your fatty acid analysis revealed that your current intake of omega-3 fish oils is sufficient. I also recommend supplements based on your clinical symptoms without any prior lab tests. So if you are suffering from sugar and carbohydrate cravings or hypoglycemia, then lipoic acid would be a good recommendation because it has been studied to help with blood sugar control. Once again, patient-centered and tailoring the recommendations to the individual patient. The connection between stress and disease is well known, but the conventional medicine doctor may not always bring it up or have the time to discuss this with the patient. In my 11-page health history questionnaire, I will know exactly what the level of stress is, high, medium, low, what the patient does for stress reduction, how often, and if I need to make any recommendations for stress reduction. For every patient, of course, stress reduction is different, so the conversation must be had with every new patient. Neurofeedback, for example, is a treatment offered at my clinic. The machine is FDA approved for relaxation. It is offered to patients with anxiety, insomnia, depression, autism, and ADHD, just to name a few. Mindfulness-based stress reduction technique was developed at Harvard based on research funded by NIH. It's a combination of meditation and yoga. There are books and courses available to help you benefit from this method that has been scientifically proven to be effective. Exercise, qigong, guided imagery, and even humor are further examples of stress reduction. Summary. Functional medicine is patient-centered. It looks for the underlying cause of your illness. It requires quality time spent with your doctor. It requires specialized tests. It looks at the whole person. Diet and nutrition is a focus, at least at my clinic. In the future, functional medicine will be the standard of care. I hope now you will have a better understanding of what functional medicine is. I wish you all the best in your quest for optimum health. Thank you for watching this video, and please hit the like button if you enjoyed it. Disclaimer: none of this information is meant to replace that of your current doctors. Seek professional advice from your current physician before implementing any of the recommendations made in this video. Thank you very much.